Hi, we are talking about anatomic position. The team is conformed by Maggie, Christian, Karime, and me, Paola. Anatomic position. Each patient and each intervention requires teamwork and the use of specific positioning, device, and equipment. The plan to positioning starts with the nurse, who shares with the team the decision of the patient's best position to facilitate activities during the anesthetic surgical activity or another activity. The objective is to facilitate access to surgical site and, most important, patient safety and prevent complications. Know which position is better depending on what will be done. And for example, when the team have to clean the patient is not the same to surgery.
Hello, my name is Karime. I'm going to talk to you about 4 basic positions. The first one is supine position. This position, we put the patient lying in his back. And this position will give the patient comfortable and support. We could use like pillows under his head, his neck, his lower back, and under the knees. It's the most common for surgeries, and the patient uses this position for resting. Also, we use this for CPR, and women use this position when they had given birth. Well, the second position is called prone position. The patient lies on his abdomen and his head is turns to one side, either left or right. We use this position for exploring his back and buttocks, and nurse uses this position for giving an injection. Well, the third one is called lateral position. A patient lies on one side, either left or right, and we need a pillow and we have to put it between the patient's knees. All these supports are for preventing to prevent pressure sores. And we need this position helps the patient to relieve pressure in his coccyx, and the patient uses this position to rest in his bed to sleep. The last position is called Fowler's position. The patient is sat on the bed. His upper body, from the hip to the head, is 45 degrees from the bed. Is suitable for patients with breathing and heart problems. This position, women that have given birth uses it for giving or feeding his new baby. It's also used for examining head, eyes, nose, ears, mouth, and chest when the doctor is gonna hear the sounds of the lungs or the heart. Well, another thing is that lateral position and basic and supine position are used by nurse when we are gonna shower the patient. And well, that's all. Thank you.
Trelleborg and inverted Trelleborg. Placed in the supine position, the feet are elevated above the plane of the head, forming an angle of 45. In the inverted position, the person in the supine position puts the head and trunk are in plane superior to that of the legs, forming an angle for 45. Lithotomy are gynecologic. In supine position, with the kidneys apart and bent, the thighs will also flexed over the pelvis. The legs should be placed stripes from on the gynecologic tables. Genupectora. Kneeling on the bed and stretch with the head tilted and resting on the bed or stretcher. The foremans flexed and the heads one and top right other. Sims position. It is a left lateral decubitus position with the arm and the legs intercedi extended in the kegel. Lower extremely flexed in the hip and knee. The left arms can be placed under the hand of extended, a long trunk so that the weight of the body rests in the chest.
Anatomical positions have a big importance because can be accommodate the patient in such a way that it find in a more comfortable position according to the problem that it's present. In this way improves them attention and will begin during their stay in the hospital, thus avoiding that the patient come to have a discomfort because it is badly positioned. That's why then exists the different position for each pathology. That's the team medical and nursing have the nose is fundamental. Each one has a function, can be only for providing comfort to the patient, even one that requires sucking. When a patient has more time, is the one's position usually not change. It's so that begin in one position and that doesn't affect you, for which is important to know which one can be placed and which not. Know which one can be benefit for harm them.